This video will be the calf video for the thoracic limb, where we're working on vessels and nerves and also intrinsic muscles on the thoracic limb. So for this lab on the calf, you'll be starting on the medial side here of the forelimb, and you want to make a skin incision from the elbow region where your prior incision started or stopped, and then take that down all the way to the mid-cannon bone region. So you're making one incision down the medial side and then making a circular incision around the cannon bone. And then you'll just remove that skin, reflect it, and you can just remove it and discard that skin from the forelimb. After that skin incision and removal of the skin there, the next step you want to make is to find your pectoral muscles. So you'll be looking at your superficial pectorals here. So we had the descending part that was here and the transverse portion here. The transverse portion is what I want you to focus on here, because you're going to make an incision and just bisect it basically in half. So you just cut it in half and you're going to pull it apart and reflect the two pieces so that you can see this area here and we can look at the vessels and nerves. So here we're on a little bit of a more cranial view, but still on the medial side here. And the first thing I want to show you is the cephalic vein. So I'm holding that in my hand here. The cephalic is running across here. And then you have the median cubital vein that you kind of see diving down under your pectorals here. So underneath your superficial pectorals. So this is that median cubital vein. And then here you have cephalic continuing distally on the limb. And then you want to find your accessory cephalic vein. So accessory cephalic is going to be this branch that's a little more cranial and should go over the carpus on the cranial aspect here. So accessory cephalic vein. Cephalic vein will continue and cross onto the medial side here. So now we'll pin back your pectorals a little bit so that we can take a look at some of the other vessels and nerves on the medial side. So here in the calf, we are starting, you can see this big nerve right away, and so that's actually the median nerve. So if you find that, you can trace that all the way down. That'll be the median nerve, and then we will also find the brachial artery. So here, I'm elevating the brachial artery. So you'll see that on the medial side. You won't be able to see some of the other branches that are a little more dorsal since we're attached here. But you can start here with the brachial artery. And you'll want to look for a couple of branches. I'm just going to lift that up. So you may see the collateral ulnar artery coming off caudally. You may not, so you can try and look for that. But if you don't find it, that's okay. Just keep following the brachial artery distally. So the branch you really want to look for is going to be diving deep down inside, and will be going in between the radius and ulna. So it's the common interosseous. So here I'm just kind of putting the probe in where it goes in between in that space. So here would be common interosseous artery running down and into that space between the bones. So common interosseous. And then our brachial artery changes names at this point and becomes median. So here, following along with that median nerve that I mentioned, is the median artery. So then the median artery will give off a radial branch. So it's the smaller branch here that goes a little more cranially, and that's radial artery. And here you'll have the median continue. So the bigger part is the median artery, smaller one is the radial artery. So if you continue to follow that through the carpal canal, you'll actually cut through this flexor retinaculum there, and that's what's holding the tendons and arteries and nerves in place. So I'm just going to try and lift them out a little bit here. So you can actually pull them out of that carpal canal and continue to follow from median artery. All right, so now we'll take a look at some of the intrinsic muscles of the forelimb. So now we're taking a look at the right side of the calf with the attached right forelimb. And we're looking at all of the muscles here, and we're going to reflect, which you should have already done, your trapezius muscle and your latissimus dorsi muscle. So those should already be done. And now we're going to take a look at some of these muscles in the proximal forelimb here. And first of all, I just want to note that the deltoideus muscle here, so here I'll kind of outline it for you. Deltoideus kind of covers your infraspinatus muscle here, so that's a little bit in the way. So you may have to reflect that one first before you look at these two muscles on the scapula. So this is deltoideus muscle here, and you can reflect that off of infraspinatus. So this is below the spine of the scapula, infraspinatus muscle here. And then supraspinatus muscle above the spine of the scapula. So the spine is here in the middle. Supra is above. So supraspinatus muscle here, infraspinatus below. So infra below down here. Then you have deltoideus that I mentioned right there. And so you want to reflect that, and also you want to transect deltoideus straight across both of these two parts here and kind of reflect that so that you will be able to see your lateral head of the triceps underneath. And so here you're looking at triceps brachii. You have long head is this big head here on the caudal aspect of the limb. Long head of the triceps, and here we have the smaller lateral head. So lateral head of the triceps here. And then after you cut your deltoideus, you want to find that lateral head and isolate its borders and then cut it straight across. So you want to reflect the lateral head also. So just reflect it down, and then you can see the brachialis underneath. So hopefully I'm not in the way, and you can see this muscle right here is the brachialis muscle. So L for lateral again, brachialis, L for lateral, on the lateral side of the limb. Brachialis muscle, and that's kind of covered by that lateral head of the triceps and deltoideus muscle here. So now we will take a little bit more of a cranial view at some of the other muscles on the forelimb. Here we have a cranial view of the thoracic limb on the calf. And so we want to look at the biceps brachii, which is going to be on the medial side, but you can see it really well from a cranial view here. So these in my hand are the superficial pectoral muscles, but you want to look at this, which is biceps brachii, this big thick muscle coming down here. So biceps, if you cut it straight across, you'll be able to see that it has this central tendon kind of inside the muscle. Oops. So kind of along here, this central tendon inside. And in the pony, we saw a really distinct lacertus fibrosis that extended from that central tendon down onto the extensor carpi radialis. In the calf, it's not as distinct, but you can see there is a band of fascia here that would be considered a lacertus fibrosis right here, extending down from biceps going on to extensor carpi radialis. And then on the proximal portion, after you transect biceps, if you reflect it, I'll move my cephalic so I can get around it. If you reflect it up, you can see this really thick tendon. So that's the bicipital tendon there. So you want to see those things before you move on. And then we will look at the extensor carpi radialis. So here in the cranial view, you can see extensor carpi radialis here. This is that brachialis muscle that we saw on the lateral side. But this is extensor carpi radialis here. And you want to follow that all the way down and see where it kind of crosses the carpus and then inserts on the proximal portion of the cannon bone. So extensor carpi radialis here, cranial aspect. Medial side, we have biceps brachii here. And lateral side, we have brachialis muscle. Now we'll take a little bit more of a caudal view at a couple of the other intrinsic muscles on the forelimb. So now we have more of a caudal view on the calf forelimb, and what you want to do is palpate right here on the carpus for that accessory carpal bone. So that's kind of the bump on the caudal aspect. So you want to find that, and then you want to find these two muscles that form a V shape and insert on that accessory carpal bone here. So the one on the lateral side here is the ulnaris lateralis muscle. So that's on the lateral side, inserting on the accessory carpal bone. And then the one on the medial side, if I can get it elevated, here we go, is the flexor carpi ulnaris. So flexor carpi ulnaris on the medial side, inserting on accessory carpal bone. Ulnaris lateralis muscle, inserting on the accessory carpal bone on the lateral side.